Therapists, I'm about to drop a truth bomb that might sting a little, but you need to know your therapy clients are cheating on you with coaches. Yes, that same client who nods appreciatively during your carefully crafted reflective statements, that is the same person who is secretly watching Mel Robbins videos at 2 a.m. and wondering why 6 months of therapy hasn't given them the same transformation that Mel is talking about and the one that they want. So today I am spilling some tea on why therapists like you, and honestly like I've been in the past, have been set up to fail in this shiny new world where literally everyone and their mother is a life coach with these perfect, Instagram posts and great haircut, promising massive results in 6 weeks through their proprietary 3-part process. We need to deal with this as a field, as a profession. And so on this episode of Love, Happiness, and Success for Therapists, I'll be revealing the awkward conversation that happened in my therapist coaching certification internship group that helped me generate a new understanding of what's really going on, and also that confirms what you're probably secretly worried about as you sense this landscape changing around you. But I'll also be telling you exactly how to become the kind of transformation specialist your clients are desperately searching for without compromising your clinical integrity or burning your license to practice therapy in a dumpster fire. So by the end of this episode, you'll know exactly why your clients have a wandering eye and what you can do about it before they ghost you for the Tony Robbins wannabe down the street. So stick around. Your practice's future just might depend on it. And if this is your first time listening, welcome to Love, Happiness, and Success for Therapists. I'm so thrilled you're here and that you found me. I'm your host, Dr. Lisa Marie Bobby. Like you, I'm a therapist. I'm a licensed psychologist. I'm a licensed marriage and family therapist. I'm a very proud board-certified coach, clinical supervisor, and founder of Growing Self-Counseling and Coaching. And in my role, I wear a couple of different hats. First and foremost, I am a therapist, supporter, and mentor and supervisor, which is what Growing Self does. That's my practice, but also why I'm here every week talking to you. But also, as a result of this, I'm also keenly aware of what is going on in the world and in our profession that affects amazing therapists like you, because in the last especially, I would say 3 to 5 years, things have been changing a lot. And what I've seen is that therapists who've kind of been chugging along, staying in their lane for 10 years or so, all of a sudden are looking up to be like, wait a minute, what's going on around here? And this is something that keeps me up at night because you've worked so hard. You do so much good in the world. You are such a standard bearer for helping people and being effective. And what I think that can do is that we're so focused on providing healing and psychotherapy in the way that we were taught, which is the right way to diagnose and treat mental health conditions and really help people heal. What I think we don't always notice is what is changing around us, and maybe even stuff that you're not so much connected to, but things that your clients are seeing and hearing and thinking about that is impacting your practice and your results. Okay, so I'm going to move away from abstraction now and provide you with a concrete example of what I'm talking about. So picture this. I am also a clinician educator. I do a coaching certification for therapists to help them obtain the board certified coaching credential through the NBCC. That's That's part of what I do. And as part of this, I host an internship group. So I have clinicians working on their credentialing. They're doing experience hours through my practice growing self. And I host an internship group. And just the other week, I am visiting with this group of 19 brilliant, dedicated, amazing therapists in this cohort who are now practicing evidence-based coaching with clients and sharing their experiences. So we're doing our regular check-in, and then this question just starts popping up from like all these different people, which is, so what do I do if I have a new client who wants to do coaching with me, but who's also in therapy at the same time? And not just one person asked this or two. It was like half the room had this question. And I think, clinicians practicing coaching are thinking about this in a very appropriate lens. I mean, ethically, a therapist cannot be in a relationship with a client who has another therapist. Like somebody needs to call that. We can't do that, right? Because it drags clients in different directions. So that is in our code of ethics. But now I have therapists being like, well, how do I handle this if I'm serving as a coach and this is going on? But so I was like, okay, let's find out a little bit more about what's going on, because there are situations when a coaching client can absolutely also be in mental health treatment. They are focusing on perhaps symptom reduction in one part of their lives, or they are perhaps maintaining historical diagnoses, bipolar disorder. It makes sense to be maintaining a relationship with a therapist and also pursuing growth and goals in a different part of your life, wanting to improve your relationship, get things dialed in with your career. Like there's a place for this. But that's not actually what my interns were telling me about. They were talking about something completely different, which is that their coaching clients seem to be maintaining relationships with therapists in this sort of more of a talk therapy, insight-oriented space. And that is honestly when this hit me like a ton of bricks. We are witnessing this massive shift in our industry, and most therapists are completely unprepared for this. And so there is a really uncomfortable truth about what's going on when therapy clients are also getting involved with coaches. And again, totally legitimate scenarios where someone could benefit from therapy and coaching simultaneously, but that is not what is happening in most cases. What it sounds like is really going on is that many people who reach out for therapy are not looking for behavioral health care, particularly in private practice. They are not seeking therapy because they need to process childhood trauma or manage clinical symptoms. What they want, what they are desperately searching for sometimes, is support and guidance in growth, development, and a process for how to create different outcomes in their lives. They're looking for transformation, not treatment. And so they come into therapy thinking, well, this will help me change my life. That's what therapy does, right? But then what happens? In a lot of traditional talk therapy, it is week after week. They are sitting across from you, talking about their thoughts and their feelings. This happened recently. Let me tell you about my mother-in-law, which, there's a place for this. And you are doing a beautiful job using all those counseling skills. You are offering beautiful reflections. You help them gain insights about why they are the way they are. And this is valuable. They understand themselves in a different way. They process some feelings. They're not quite as reactive. But 6 months later, they're still struggling with the same relationship patterns. They're still trying to figure out how to deal with their boss. They're still stuck in the same career rut. They're still not following through on their goals. Because here's the hard truth that nobody in our field wants to acknowledge. Insight is not enough to change your life. You can have all the awareness in the world about why you procrastinate, why you keep dating emotionally unavailable people, why you avoid conflict. You know why. But that awareness alone doesn't create transformation. And a lot of what therapists know how to do, if we are not actively treating a psychiatric diagnosis, we are doing insight-oriented talk therapy, which is not designed for transformation. And I'm about to say something controversial, but so true. Therapy is designed for healing, processing, understanding. And I know you know this. Two things happen when we go to counseling school. We can go clinical mental health route where we get very clear on disorders, major mental health issues, psychiatric diagnoses, post-traumatic stress disorder, anxiety disorders, eating disorders, substance use disorders. And this is super valid and incredibly important. And we learn systems to help people who are in the grips of these debilitating mental health issues that are impairing their ability to function or have, functional lives, like be the people that they want to be, but like they're impaired. We learn how to take these people, meet them where they are, and walk with them to a place of healing where they are, out of that pit, and now they are on solid ground. And this is so valuable in the world. The world needs us to be able to do this. But when we therapists aren't doing that, there are other places we can go, which is into this. What brings you in? How may I be of service? Tell me how you're feeling. This insight-oriented, client-centered, just unpacking, right? And we often attempt to work with non-clinical clients from this stance. So we're not helping these people get out of the pit and back on solid ground. We are meeting with people who are on solid ground. They're not just getting out of bed. They're doing, marathons, and they are operating businesses, and they have beautiful lives, and they are very high functioning people who are coming in saying, I would like to have a better relationship. I don't think I'm on the right career path. I'm feeling unsatisfied. I'm going through a life transition. I would like to improve myself in one of these areas. Can you help me? And so think about your training for a second. Like, how many courses did you take on values-based goal setting or accountability structures or on behavioral design or habit formation or creating measurable outcomes? If you're like most therapists, like me, I didn't have any of that. My answer to that was absolutely not. I did not learn how to do that, which is, by the way, what is happening in evidence-based coaching psychology. Therapists roll their eyes when the coaching word gets, thrown into the air, and, not to be blamed, because most people practicing coaching aren't doing evidence-based coaching psychology either. But this is what we therapists need to learn how to do in order to be really effective with clients and help deliver the kinds of outcomes and transformation that they come into our practice seeking. Because if we don't learn how to do this, we do what we know how to do, which is to create a safe space. We reflect feelings, we explore past experiences, and help people connect the dots. And these are beautiful, necessary skills, and they are absolutely part of powerful transformational coaching when done well. But it can't stop there. Those skills, those are counseling skills, and they are not the skills that are designed to help somebody get unstuck and create real change in their present life. They answer questions around, who am I and how do I get here? They do not define who do I want to be and how do I move forward. So here's what happens. clients come in because they want that. They want to figure out where they're going to go and how to get there. And they think that therapy is the avenue to create that. So what happens? They show up, you guys start talking, and you know what? It's interesting. For the first 6-8 sessions, they are unraveling things. They're in that discovery phase. The light bulbs are going off. They're like, yeah, that totally makes sense. And it's fantastic. And you're doing great work. And your clients like you. They value talking to you. It is affirming. It is validating. They understand themselves better. They feel cared for by you, and they develop an attachment to you. And every week they are faithfully showing up to process, to tell you about the things, and to, yes, this all makes sense. But over a period of time, their experience of this starts to change. By week 8, 10, 12, if they're not coming in with mental health stuff that has to be treated, like that's a different animal, right? If they're coming in from a strong foundation, they're here to grow, figure themselves out, create change, they start to get frustrated. By week 10, sometimes sooner, they are already wondering why they're not seeing more tangible process. Maybe you're getting some of these questions like, how long is this going to take? Or when do you think I can start, seeing outcomes in my life based on the things that we're talking about here in the room? And then one day, while your client is scrolling through Instagram, they come across one of the thousands of coaches who are out there saying, confidently, like, here's the way to change your life. They're going to come across one of these people who's going to be speaking directly to your client's desires. They're saying, want to finally break your procrastination habit in just 30 days? Here's what to do. Or ready to attract the relationship that you deserve? 5 steps to reinvent your career and find your purpose. I mean, this is what people all around your clients are saying and promising. And then they show up next week and you're like, so let's talk about this thing that happened in your past again. And your client is like, okay. And so the reality that we are now inhabiting is that Mel Robbins is taking over the universe. Tony Robbins, Brene Brown, Jay Shetty, these aren't just self-help gurus anymore. These people are becoming mainstream cultural forces who are speaking directly to your client's desire for change and for direction. And here's what makes these people so appealing. They are confident, they're inspiring, they're focusing on action and results, not just understanding, and they are offering clear structures and promises of transformation. So your clients are thinking, I want some of that. And they reach out to coaches. Now, they're still attached to you. They like being able to come and talk to you and process and download and talk about their feelings and have a little cry and wander back out again. But they no longer trust you, trust me, trust therapists who are operating in this old way to be the guides that can carry them forward. And so they step out and they start looking for other people. And it is a mixed bag around who those people are that they're going to be connecting with. Your client could have the great fortune of connecting with a professional therapist who has become a highly qualified certified coach who practices evidence-based coaching psychology, in which case they're likely going to have great results. But the other side of this reality is that most coaches have zero clinical training, no background in mental health, and also they do not have training in coaching psychology. They are just really smart and have life experiences that they would like to teach other people now. Some of them literally decided to become a coach last Tuesday after reading a self-help book or watching a really inspiring podcast and thinking, you know what, I can do that too. And they're great at marketing. They're great at selling themselves. And now they are attracting your clients because they're offering something different that traditional therapy doesn't, a clear path to change. And so here's where things get really sticky from an ethical standpoint for therapists too. One of the things that I was thinking about as I was listening to my coaching interns tell me stories about all these clients who are in sometimes long-term relationships with therapists, but who are now like, hey, can we do coaching together? Because I love my therapist, but what I really want is XYZ. There's like a different problem that goes into our ethical code as therapists. Because if a therapist, and there's a time and a place for long-term therapy clients, right? But if we have clients who have been seeing us for years and are coming in and talking about things, but who aren't really making progress and getting their needs met, if they're coming in each week to download things, explore issues, but their actual life isn't changing, and to the point where they're looking into other options, we need to know about that, and we need to address it and resolve it, because our code of ethics requires us to practice two pillars of ethics. Avoiding malfeasance, obviously, but also beneficence. Is my client benefiting from this? We are supposed to be helping people in a way that they want us to help them, not creating dependency. We are not here to have personal relationships with clients. This is a professional relationship. We're here for a reason. And it is our ethical duty as therapists to be thinking about, is my relationship with this client serving a purpose in their life, or is it potentially preventing them from developing other intimate relationships? Should we be talking about that in our sessions? If they're telling me they don't have anybody else to talk to about their thoughts and feelings, like maybe we turn that into a goal. But if our clients are also looking elsewhere and outside the relationship with us to create outcomes, that is also a sign that our work with them has likely come to an end, and that we probably need to either let them go and trust, hopefully they've connected with a competent coach who could actually help them, or consider modifying our approach and our skill set as therapists in order to meet the needs and desires of our clients in this changing landscape. Because if we're not doing that, our therapy clients are going to be like, well, wandering off, which, if our time with them has truly come to an end, that is also fantastic. We all know that we need to be working ourselves out of a job with every client in therapy, right? But I think it is also worth considering whether or not we therapists need to be stepping assertively into this coaching space and learning the competencies that will allow us to assist our clients with this totally different type of work that they want to do, right? We are going to pivot away from only really understanding how to help people get out of a hole and back into solid ground. That is what we do with clinical mental health. And then there's that middle space of developing self-awareness and insight that we can do with non-directive, insight-oriented talk therapy. But there is a whole new world for therapists that most therapists don't even know anything about, which is creating clarity, direction, values-based goals, and then supporting our clients as they actively work through this structured system of how to create change, which requires us to show up in a completely different way, and for us therapists to utilize totally different competencies, theories, methods in order to facilitate this type of transformational change. And what I'll also tell you is that when therapists learn how to do this, it is rocket fuel. It is unlike anything else that your clients can get when working with a standard issue clinical mental health or traditional talk therapy type therapist. And it is also completely unlike anything that your clients can get from working with a air quote coach who was a real estate agent 3 weeks ago, but put together a really slick website and knows how to work social media. That is a totally different thing than what professional therapists like us can do when we learn how to practice coaching psychology. So this is already happening, whether or not you like it. Your therapy clients are looking over the fence, seeing some greener grass, and they're either wandering off altogether and saying, oh, I'm getting busy with work, or, oh, money's getting tight. So, but they're like, yes, Mel Robbins, tell me more, right? This is already happening. So I think the challenge here is to be thinking about your career and what you can do as a therapist in this brave new world where coaches are promising the moon and the stars while you are, engaging in reflective listening and, oh, how do you feel about that? So the answer to this is super simple. Learn coaching, not in a haphazard, way, or, oh yeah, solution-focused therapy, same thing, or I'm just going to start being more directive kind of thing. No, I am talking about getting properly certified in evidence-based coaching psychology, because here's the exciting part. When you integrate these coaching skills with your therapeutic experience, you just become this unstoppable force for transformation. You have the psychological depth that most coaches lack, and this action-oriented, results-focused approach that your clients crave and that most therapists don't have either. So now you can pivot confidently. You have more diversity, and you can work with non-clinical clients and be the transformational leader they want and need you to be, while also maintaining your clinical integrity and ethical standards. And just before we wrap up, I want to tell you that this is not about abandoning therapy. I love therapy. The world needs you to be that. You are a healer. You are a helper, and we cannot stop doing this. And it is about understanding what's going on around you in the world and being able to expand your toolkit to learn a new modality that will help you serve a broader range of client needs and desires. So if you're like, thank you for telling me, Lisa, I didn't really understand what was happening, but scrolling through your mind, have you had clients let you know, maybe even a little bit sheepishly, that they're also talking to a coach, or just, kind of go and I'm like, oh, I wonder what happened. Or if you're having clients say, when is this going to start, working? It's really time to be developing yourself in order to continue to be competitive in this new world. I have free resources that I have designed for you to help you learn more about what is going on here. First of all, I have been doing a webinar series. The next one coming up is all about what therapists need to know about the differences between coaching and therapy. So differences, but also similarities between the two. And this is especially crucial for you if you're a therapist who has been trying to dabble a little bit in the coaching realm, but feeling some anxiety that you might be blurring boundaries or crossing lines. With love, trust your instincts, because most therapists are before they really learn, like, okay, here's how to tell the difference. So watch this webinar. It is going to clear some things up for you. You can head over to growingself.com/learn. growingself.com/learn to sign up, or just come to growingself.com and tap on the big 4 therapists tab at the very top of my website. And then you'll see a big menu with all of the different resources, including this one. And additionally, I created a free 2-part training for therapists. It's called A Therapist's Guide to Coaching, and it does a deep dive into what coaching is. It talks about what is involved with coaching certification, what therapists who practice coaching are doing differently. And I also put together a companion workbook that goes along with this 2-part training to help you get some clarity around where you are professionally at this point in your career and where to really focus. Like we had talked today about mental health and getting clear around a professional niche that you specialize in, or, this insight-oriented talk therapy space. Or if you did want to move into working with more non-clinical clients, not just learning coaching modalities, but then a specialized area of expertise around which to coach. So for example, divorce recovery coaching or parent coaching, dating coaching, relationship coaching. This workbook will help you start to develop a vision for your own career and help you set some goals and put together an action plan to help you get there. So to access this free training, also go to my website, growingself.com, hit that 4 therapists tab in the main nav and grab the Therapist's Guide to Coaching. So, closing thoughts. Look, I get it. You became a therapist because you wanted to help people heal, grow. You're good at what you do, and there's always going to be a need for skilled psychotherapists who can help people with major mental health issues, processing trauma, overcoming very difficult life experiences, managing mental health conditions, and also exploring their inner world. I mean, there's a place for that. But things are happening around you, whether you like it or not. And if you want to have a leg to stand on when you are working with motivated, growth-oriented clients who now have a lot of other options than they did a few years ago, they are currently being actively seduced by coaches on Instagram. If you want to be that person that can help people not just understand themselves, but move forward on a path of transformation, it is time to adapt and expand your skill set. So the choice is yours. I'm here to help you every step of the way. Check out the free resources, all on growingself.com. And thank you again for spending this time with me today. That's it for this episode of Love, Happiness, and Success for Therapists. But the conversation isn't over. I'd love to keep it going. Connect with me on LinkedIn. Look me up, Dr. Lisa Marie Bobby. Connect with me. We will be friends there. If you were listening to this feeling inspired, please share it with a therapist friend or professional colleague who would benefit from this too. And don't forget to sign up for the free webinars and free trainings that I mentioned earlier. And until next time, just remember, the world needs therapists just like you who can not only heal, but also transform. And that therapist can be you. It's time for you to grow too. All right, I'm going to stop talking now. Thanks for listening, and I'll see you next time.